Welcome to The Explainer. Today, we're going to break down a medical procedure that, let's be honest, can look pretty complicated. But at its core, it's all about simple, powerful principles. We're talking about orthopedic traction.
Yeah, if you've ever seen a setup like this, with all the ropes, pulleys, and weights, it can look a little intimidating, right? Well, stick with me, because by the end of this, you're going to understand exactly what's happening, why it's so crucial, and how this whole system really helps the body heal.
All right, let's dive right in with the most basic question. At its heart, what even is traction? It's really just the art of using a pulling force, but in a very, very controlled way to help someone heal.
So, if you strip away all the equipment, all the gear, this is what you're left with: a steady, continuous pull. This force is carefully calculated to work against the body's own forces, like a muscle spasm that might be trying to pull a broken bone out of place. It's kind of like a constant, gentle persuasion, guiding the body to heal correctly.
And the thing to really get here is just how versatile it is. This one simple pulling force does a ton of different jobs. It can align a fracture, sure, but it also helps calm down those painful muscle spasms and can even prevent long-term problems like contractures. That's when your muscles and joints get permanently stiff. It's a real multi-tool in the world of orthopedics.
But, and this is a big but, you can't just start pulling and hope for the best. For traction to actually work, and more importantly to be safe, it has to follow a really strict set of rules. These are the non-negotiables. So for any students watching this, you're going to want to pay close attention here.
Okay, so these rules are absolutely crucial. For traction to work, you need countertraction. That's an opposing force, and usually it's just the patient's own body weight pulling in the opposite direction. But I really want you to focus on rule number 4. The weights have to hang freely. I mean, think about it. If they're resting on the floor or they get caught on the bed frame, poof, the pulling force is gone. The therapy just isn't working anymore. It's such a critical, hands-on detail for any nurse or doctor.
Okay, so we've got the what and the why down. Now let's get into the how. Let's look at the different ways this pulling force is actually applied to a patient.
Really, the biggest difference comes down to one question. How does that pulling force connect to the body? Is it on the skin, or is it attached directly to the bone? Skin traction uses things like straps or special boots. It's way less invasive and uses lighter weights, so it's perfect for shorter-term situations. Skeletal traction, on the other hand, is the heavy-duty option. We're talking pins placed right into the bone. This lets you use much heavier weights for much longer, which you need for really severe fractures.
So with skin traction, you'll see common setups like bucks traction, maybe for hip fracture before surgery. The key thing here is that it's often a bridge, a temporary fix to keep things stable and manage pain until a more permanent solution, like surgery, can happen. And, it totally makes sense, right? Because the force is pulling directly on the skin. The biggest risks are all about, the skin. The care team has to be constantly checking for any breakdown, pressure sores, and making sure blood is circulating properly in that area.
Skeletal traction comes into play when you need a stronger, more direct, and longer-lasting pull. A halo device for a really bad neck injury is a classic example. This method lets you use some serious weight, which makes it possible to align really complex fractures and hold them perfectly still for weeks, sometimes even months.
Now, in contrast to skin traction, the risk here isn't the skin itself, it's that direct pathway into the bone. So the number one concern is infection, starting right where the pin goes in and potentially spreading into the bone. That's a really serious condition called osteomyelitis.
This table here is a fantastic quick reference. It connects all the dots linking a specific type of traction to the injury it's usually used for. You can see right away that bucks is the go-to for a hip fracture, while a halo is for those serious cervical spine injuries. It's a super handy cheat sheet for anyone in the medical field.
So, with all these rules and different types and all the potential risks, you might be wondering, what's the payoff? Why go through all this trouble? Well, let's look at the positive side of things. And here's what it's all about. By keeping that bone in perfect alignment and reducing muscle spasms, traction creates the absolute ideal environment for a bone to heal straight and strong. It provides pain relief and, most importantly, it gives that injured area the stability it needs to repair itself the right way, which means a much better outcome for the patient in the long run.
Okay, this brings us to the human side of this whole equation. A traction setup is not something you can just set and forget. No way! It needs constant, careful attention from the healthcare team to make sure it's working and, of course, to keep the patient safe.
And these responsibilities are so important. We're talking everything from making sure the patient's body is in a straight line to meticulously cleaning those pen sites to prevent infection. Every single step is vital. It's also super important to get the patient to exercise their unaffected muscles and joints to keep their strength up and prevent other problems from setting in.
And this slide really highlights the big challenge, right? While traction is keeping one part of the body perfectly still so it can heal, the rest of the body is also immobile. And that brings its own set of risks. We're talking pressure sores, muscle wasting, and even dangerous blood clots, known as deep vein thrombosis. These are all serious concerns that the care team has to work really hard to prevent.
So in the end, it all comes back to this one simple, pretty elegant concept: a steady, controlled pull. It's a great reminder that sometimes the most effective treatments aren't the most high-tech ones. Instead, they're based on a really deep understanding of basic physics and anatomy. It kind of makes you wonder, right? What other seemingly simple ideas are still cornerstones of modern medicine today?